Question 1. A 2-month-old with lethargy and poor feeding is suspected of sepsis. The provider orders antibiotics to start after a lumbar puncture. The infant becomes apneic while waiting. What should the nurse do first? A. Begin bag mask ventilation and stabilize before LP. B. Proceed with LP immediately to confirm diagnosis. C. Notify the provider and wait for instructions. D. Place infant prone and stimulate to breathe. Answer. A. Begin bag mask ventilation and stabilize before LP. Rationale. Airway and breathing are always priority. Diagnosis can wait. Stabilization comes first. B. Delays life-saving care. C. Waste time. D. Stimulation alone is insufficient in apnea. Question 2. A 5-year-old with croup is agitated, drooling, and has stridor at rest. Which nursing intervention demonstrates the best critical judgment? A. Prepare to administer racemic epinephrine while keeping the child calm. B. Obtain a throat swab for culture before giving medications. C. Encourage oral intake to maintain hydration. D. Place the child supine to reduce airway pressure. Answer. A. Prepare to administer racemic epinephrine while keeping the child calm. Rationale. Severe croup requires airway stabilization with nebulized epinephrine. B. Increases obstruction risk. C and D both worsen risk of aspiration and airway compromise. Question 3. A school-age child with type 1 diabetes has Kussmaul respirations, fruity breath, and blood glucose 420 milligrams per deciliter. Which order should the nurse question? A. Start IV insulin infusion. B. Begin IV fluids with 0.9% NS. C. Administer IV potassium chloride before urine output is established. D. Monitor blood glucose hourly. Answer. C. Administer IV potassium chloride before urine output is established. Rationale. Potassium must not be given until renal function or urine output is confirmed. Risk of hyperkalemia. A, B, D are correct interventions. Question 4. Parents refuse vitamin K injection for their newborn. What demonstrates the nurse's best judgment? A. Respect refusal, but provide thorough documentation of teaching and risks. B. Notify CPS immediately for neglect. C. Administer vitamin K without consent for safety. D. Delay education until discharge to reduce conflict. Answer. A. Respect refusal, but provide thorough documentation of teaching and risks. Rationale. The nurse must educate, respect parental choice, and document. CPS is not warranted unless ongoing harm. Administering without consent is unlawful. Delaying teaching violates informed care. Question 5. A 12 kilograms toddler is prescribed ibuprofen 15 milligrams per kg Q6 HIV for fever. What is the nurse's best action? A. Clarify the order due to unsafe dosing and route. B. Administer the medication as written to avoid delay. C. Reduce the dose independently to 10 milligrams per kg. D. Withhold medication and document refusal. Answer. A. Clarify the order due to unsafe dosing and route. Rationale. IV ibuprofen is not standard for toddlers and 15 milligrams per kg is above recommended. Nurses clarify unsafe orders. Never change independently or ignore. Question 6. A 4-year-old with suspected epiglottitis arrives cyanotic. What is the nurse's immediate priority? A. Call anesthesia for intubation while avoiding throat exam. B. Insert an oral airway for obstruction. C. Obtain IV access for emergency meds. D. Attempt to visualize airway with tongue blade. Answer. A. Call anesthesia for intubation while avoiding throat exam. Rationale. Controlled intubation is life-saving. Oral airway and tongue blade may trigger complete obstruction. IV access can wait until airway secured. Question 7. A 9-month-old on aminoglycoside therapy has a trough level of 4 micrograms per ml, normal 2. What should the nurse do first? A. Hold the next dose and notify the provider. B. Give extra IV fluids to flush the drug. C. Administer the dose but increase interval. D. Continue medication, monitor for ototoxicity. Answer. A. Hold the next dose and notify the provider. Rationale. Elevated trough equals toxicity risk. Nurse must hold and notify. Be supportive but not primary. C and D are unsafe without provider input. Question 8. A 10-month-old postoperative infant is crying and inconsolable. Which tool is most accurate for pain assessment? A. Flack scale. B. Numerical rating scale. C. Visual analog scale. D. Wong-Baker faces. Answer. A. Flack scale. Rationale. Flack is validated for nonverbal infants. Others require verbal or abstract reporting skills. Question 9. A 6-year-old with asthma has peak flow 48% of personal best, SpO2 90%, and tachypnea. What should the nurse do first? A. Administer short-acting beta agonist and reassess. B. Notify the provider for possible intubation. C. Encourage pursed lip breathing exercises. D. Start IV corticosteroids immediately. Answer. A. Administer short-acting beta agonist and reassess. Rationale. Immediate bronchodilator is life-saving. IV steroids take longer. Intubation may be required if bronchodilator fails. Breathing exercises are inappropriate during acute distress. Question 10. A child is admitted with hyponatremia after hypotonic IV fluids. Which action shows safe clinical judgment? A. Switch to 0.9% NS and monitor neurologic status closely. B. Continue hypotonic fluids but reduce rate. C. Restrict oral fluids and continue same IV therapy. D. Give hypertonic saline bolus rapidly. Answer. A. Switch to 0.9% NS and monitor neurologic status closely. Rationale. Isotonic fluids correct safely. Hypertonic saline is for severe symptomatic cases and must be cautious. B and C worsen hyponatremia. Question 11. A 3-year-old with spiral fracture and inconsistent history is hospitalized. What should the nurse document to meet legal responsibility? A. Exact statements and observations without interpretation. B. Suspicions and conclusions about caregiver intent. C. Only the medical team's diagnosis. D. Nothing until CPS confirms abuse. Answer. A. Exact statements and observations without interpretation. Rationale. Accurate. Objective documentation supports investigation. Interpretation or delay is unsafe or legal risk. Question 12. A 7-year-old is behind on vaccines and requires pertussis protection. Which immunization is correct? A. TDAP single dose. B. DTaP series restart. C. TD only. D. No further pertussis needed. Answer. A. TDAP single dose. Rationale. TDAP is indicated for children greater than or equal to 7. Restarting DTaP not recommended. TD omits pertussis. Question 13. A 2-year-old with dehydration has now 122 milliequivalent per liter. What should the nurse anticipate? A. Careful correction with isotonic or hypertonic saline under monitoring. B. Rapid correction with free water bolus. C. Immediate potassium replacement. D. Dextrose-only infusion to correct hyponatremia. Answer. A. Careful correction with isotonic or hypertonic saline under monitoring. Rationale. Rapid correction risks central pontine myelinolysis. B, C, D are inappropriate. Question 14. A 10-year-old with sickle cell disease reports chest pain and fever. What is the nurse's highest priority? A. Administer oxygen and notify provider of possible acute chest syndrome. B. Give IV opioids for pain. C. Encourage ambulation and fluids. D. Apply heat packs to chest. Answer. A. Administer oxygen and notify provider of possible acute chest syndrome. Rationale. Acute chest syndrome is life-threatening. Pain control is needed, but not priority over airway. C and D supportive, not priority. Question 15. Teaching iron supplementation to parents of a 6-month-old. Which action shows correct understanding? A. Giving with orange juice to improve absorption. B. Mixing with milk to reduce GI upset. C. Stopping if stools turn black. D. Crushing tablets for cereal. Answer. A. Giving with orange juice to improve absorption. Rationale. Vitamin C increases absorption. Milk decreases absorption. Black stools are expected. Tablets unsafe in infants. Question 16. A 7-year-old with Kawasaki disease has persistent fever after IVIG. What is the next evidence-based action? A. Prepare for repeat IVIG infusion. B. Discontinue aspirin therapy. C. Begin broad-spectrum antibiotics. D. Provide only supportive care. Answer. A. Prepare for repeat IVIG infusion. Rationale. Refractory cases need repeat IVIG. Aspirin therapy continues. Antibiotics only if infection. Supportive care alone insufficient. Question 17. Parent education on febrile seizures. Which statement requires correction? A. Will alternate acetaminophen and ibuprofen around the clock to prevent seizures. B. Most febrile seizures stop within a few minutes. C. We should place our child on their side during a seizure. D. We'll call emergency services if seizure lasts more than 5 minutes. Answer. A. Will alternate acetaminophen and ibuprofen around the clock to prevent seizures. Rationale. Antipyretics do not prevent febrile seizures. Alternating can cause dosing errors. Other statements are correct. Question 18. A 16-year-old pregnant teen seeks care without parents. Which action demonstrates ethical and legal nursing judgment? A. Provide confidential pregnancy-related care per minor consent laws. B. Require parental permission before care. C. Inform parents regardless of consent. D. Delay care until social services is involved. Answer. A. Provide confidential pregnancy-related care per minor consent laws. Rationale. Most jurisdictions allow minors to consent to pregnancy care. Parental involvement may be encouraged but not required. Question 19. A toddler with bronchiolitis has SpO2 88% and severe retractions. Which intervention is priority? A. Suction airway and initiate supplemental oxygen. B. Encourage oral fluids to prevent dehydration. C. Begin chest physiotherapy immediately. D. Administer OTC cough suppressant. Answer. A suction airway and initiate supplemental oxygen. Rationale. Airway clearance and oxygenation are first priority. Fluids and CPT may worsen distress. Cough meds are contraindicated. Question 20. Preparing a 3-year-old for IV start. Which action shows best atraumatic care? A. Explain in simple terms. Allow choice of toy for comfort. Use topical anesthetic. B. Restrain the child quickly to finish faster. C. Tell the child it won't hurt to reduce fear. D. Do multiple practice pokes to get used to it. Answer. A. Explain in simple terms. Allow choice of toy for comfort. Use topical anesthetic. Rationale. Developmentally appropriate explanation, comfort choices, and pain relief reduce trauma. Restraint, dishonesty, and repeated sticks damage trust. Question 21. a 5-year-old with cystic fibrosis, is admitted with increased thick sputum production and fever. The nurse receives orders for chest physiotherapy, IV antibiotics, and pancreatic enzymes with meals. Which intervention should the nurse prioritize first? A. Administer IV antibiotics immediately. B. Perform chest physiotherapy before meals. C. Give pancreatic enzymes with breakfast. D. Monitor oxygen saturation and apply oxygen if less than 92%. Answer: D. Monitor oxygen saturation and apply oxygen if less than 92%. Rationale: airway and oxygenation are always the first priority in cystic fibrosis exacerbations. Antibiotics and enzymes are important, but come after ensuring oxygenation. Chest physiotherapy before meals helps, but is not first if oxygenation is compromised. Question 22. A toddler with Kawasaki disease is irritable and febrile despite IV immunoglobulin infusion. What should the nurse do next? A. Notify the provider about possible IVIG resistance. B. Administer aspirin as prescribed. C. Place the child in a quiet, dark room. D. Encourage fluids to reduce fever. Answer: A. Notify the provider about possible IVIG resistance. Rationale: persistent fever after IVIG suggests resistance, requiring a second dose or alternative therapy. Aspirin is supportive but not sufficient. Comfort and fluids help but don't address the underlying failure of treatment. Question 23. A school-age child with sickle cell crisis is crying from severe leg pain. The provider orders IV fluids, oxygen, and morphine. Which action should the nurse take first? A. Apply warm compresses to the leg. B. Start IV fluids as prescribed. C. Administer oxygen via nasal cannula. D. Administer morphine for pain relief. Answer: C. Administer oxygen via nasal cannula. Rationale: oxygen reduces sickling, preventing further complications. Fluids and pain relief are important, but secondary to improving oxygenation. Warm compresses provide comfort, but are not priority. Question 24. A 10-year-old with new-onset type 1 diabetes presents with fruity breath, McQs-nclex respirations, and blood glucose of 450 milligrams per deciliter. What is the nurse's priority action? A. Start IV insulin drip. B. Begin IV normal saline infusion. C. Monitor potassium levels closely. D. Administer subcutaneous insulin. Answer: B. Begin IV normal saline infusion. Rationale: in diabetic ketoacidosis, fluid resuscitation with IV normal saline is the priority to correct dehydration and restore perfusion before insulin therapy. Potassium monitoring is essential but comes after fluids. Subcutaneous insulin is inappropriate. Question 25. A 2-year-old post-tonsillectomy is refusing fluids and begins frequent swallowing. What is the most concerning complication? A. Dehydration. B. Hemorrhage. C. Pain crisis. D. Airway obstruction from swelling. Answer: B. Hemorrhage. Rationale: frequent swallowing after tonsillectomy suggests bleeding. This is life-threatening and must be assessed immediately. Dehydration, pain, or swelling are concerning, but not as critical as hemorrhage. Question 26. A nurse is caring for a 3-year-old with nephrotic syndrome, receiving prednisone. Which finding requires immediate intervention? A. Weight gain of 1.5 pounds in 2 days. B. Increased facial swelling. C. Abdominal distension with decreased urine output. D. Blood glucose of 145 milligrams per deciliter. Answer: C. Abdominal distension with decreased urine output. Rationale: this indicates fluid overload and possible worsening kidney function, requiring urgent attention. Weight gain and swelling are expected but less urgent. Mild hyperglycemia is common with steroids. Question 27. A 15-year-old with anorexia nervosa has a potassium of 2.8 milliequivalent per liter. What is the priority nursing action? A. Provide potassium-rich foods. B. Place the client on a cardiac monitor. C. Educate on importance of nutrition. D. Encourage oral potassium supplements. Answer. B. Place the client on a cardiac monitor. Rationale. Hypokalemia less than 3.0 places the child at high risk for arrhythmias. Monitoring comes before replacement or teaching. Question 28. A 6-year-old with suspected meningitis is admitted. Which nursing action is most critical? A. Initiate droplet precautions. B. Administer IV fluids. C. Assess neurological status hourly. D. Administer broad-spectrum antibiotics. Answer. A. Initiate droplet precautions. Rationale. Preventing spread of meningitis is priority before other actions. Antibiotics are urgent but must follow isolation. Neurochecks and fluids are supportive but not first. Question 29. The nurse is caring for a neonate with a myelomeningocele sac on the lower back. Which intervention is most important? A. Cover the sac with a sterile, moist, non-adherent dressing. B. Place the infant supine with the head elevated. C. Administer IV antibiotics as ordered. D. Delay feedings until surgery is scheduled. Answer. A. Cover the sac with a sterile, moist, non-adherent dressing. Rationale. Protecting the sac from infection and rupture is priority. Supine position increases risk of rupture. Antibiotics and feedings are important but secondary. Question 30. A 4-year-old receiving chemotherapy develops oral mucositis. Which action is most appropriate? A. Use hydrogen peroxide rinses. B. Provide soft toothbrush for oral care. C. Administer viscous lidocaine before meals. D. Encourage lemon-flavored candies. Answer. B. Provide soft toothbrush for oral care. Rationale. Gentle oral care prevents infection and reduces pain. Hydrogen peroxide and acidic foods worsen irritation. Lidocaine may impair gag reflex and increase aspiration risk. Question 31. A 12-year-old with asthma suddenly becomes quiet, with decreased wheezing after using a rescue inhaler. What is the nurse's best action? A. Encourage rest. B. Notify the provider immediately. C. Document the improvement. D. Administer another inhaler dose. Answer. B. Notify the provider immediately. Rationale. Silent chest suggests impending respiratory failure. Immediate escalation is needed. Rest or documentation delays care. Extra inhaler dose is unsafe without provider input. Question 32. A 7-year-old with suspected appendicitis reports sudden relief of severe pain. What does this indicate? A. Normal improvement. B. Bowel obstruction. C. Perforation of the appendix. D. Side effect of medication. Answer. C. Perforation of the appendix. Rationale. Sudden pain relief followed by worsening illness suggests rupture, a surgical emergency. This is not normal improvement or obstruction. Question 33. A nurse is caring for a 6-month-old with bronchiolitis. The infant has nasal flaring, retractions, and O2 saturation of 88%. What is the priority intervention? A. Suction nasal secretions. B. Apply humidified oxygen. C. Administer nebulized albuterol. D. Encourage oral hydration. Answer. A. Suction nasal secretions. Rationale. Infants are obligate nose breathers. Suctioning secretions improves airway clearance. Oxygen is important but comes after airway patency. Albuterol is not first line in bronchiolitis. Question 34. A 13-year-old with leukemia is on neutropenic precautions. Which action indicates the nurse needs further teaching? A. Allowing fresh flowers in the room. B. Using disposable gloves for oral care. C. Restricting visitors with colds. D. Providing a low-bacteria diet. Answer. A. Allowing fresh flowers in the room. Rationale. Fresh flowers harbor bacteria and fungi, increasing infection risk. Other precautions are appropriate. Question 35. A 9-year-old with spina bifida is at greatest risk for which complication? A. Latex allergy. B. Osteoporosis. C. Diabetes mellitus. D. Hypertension. Answer. A. Latex allergy. Rationale. Spina bifida is strongly associated with latex allergy due to frequent exposure from surgeries and catheterization. Question 36. A nurse is teaching parents of a child with congenital hypothyroidism about medication administration. Which statement shows understanding? A. Will give the medication at bedtime. B. Will mix the medication with formula. C. Will give the medication crushed with a small amount of applesauce. D. Will stop the medication if symptoms improve. Answer. C. Will give the medication crushed with a small amount of applesauce. Rationale. Levothyroxine must be given consistently, usually in the morning, and not mixed with formula. It is lifelong, not to be stopped. Applesauce is appropriate for administration. Question 37. A 4-year-old is post-cardiac catheterization. Which finding requires immediate intervention? A. Mild bruising at insertion site. B. Oozing blood at insertion site. C. Child reports hunger and thirst. D. Low-grade fever of 100.4 degrees Fahrenheit, 38 degrees Celsius. Answer. B. Oozing blood at insertion site. Rationale. Active bleeding requires immediate pressure and intervention. Other findings are expected or minor. Question 38. A 2-year-old with lead poisoning has a blood lead level of 52 micrograms per deciliter. What is the nurse's next action? A. Encourage iron-rich foods. B. Administer chelation therapy. C. Provide increased calcium intake. D. Restrict playtime outside. Answer. B. Administer chelation therapy. Rationale. Levels above 45 micrograms per deciliter require chelation therapy. Nutrition and environmental changes are helpful, but not immediate treatment. Question 39. A nurse is caring for a 10-year-old with acute lymphoblastic leukemia, receiving chemotherapy. Which lab result requires immediate action? A. Platelets 45,000 per cubic millimeter. B. Hemoglobin 9G per deciliter. C. ANC absolute neutrophil count 200. D. WBC 15,000 per cubic millimeter. Answer. C. ANC absolute neutrophil count 200. Rationale. ANC less than 500 indicates severe neutropenia and very high infection risk. Platelets and hemoglobin are low, but not immediately life-threatening. Question 40. A nurse is preparing to administer digoxin to a 4-year-old. Which assessment requires the nurse to withhold the medication? A. Heart rate of 68 BPM. B. Nausea and vomiting. C. Fatigue and weakness. D. Respiratory rate of 22. Answer. A. Heart rate of 68 BPM. Rationale. For children, a HR less than 70 BPM is a contraindication for digoxin administration. Nausea, vomiting, and fatigue may indicate toxicity, but require confirmation after holding the dose. If you found this video helpful, don't forget to like, subscribe, and share with your fellow nursing students. Hit the bell icon so you never miss an update. See you in the next one. Happy studying.